Today I am here to demonstrate BLS or CPR procedure. What is CPR? What is BLS? CPR means cardiopulmonary resuscitation. BLS means basic life support. Before moving on to the topic, we should know when we are going to perform this procedure, when to perform this. If there is a victim of cardiac arrest or heart attack, what is difference between cardiac arrest and heart attack? Cardiac arrest means when heart stops functioning immediately. Heart attack means when there is a lack of blood flow to the heart and because of that heart functioning is being stopped. This is the difference between cardiac arrest and heart attack. If you see any victim with any of these two, cardiac arrest or heart attack, what should be done immediately to the patient to save the life of the patient? That is the procedure called as BLS or CPR. The main function of the heart is to pump the blood to all the systemic organs of the body. Think when heart stops functioning suddenly, what happens? Systemic organs including brain, all vital organs will not get any blood supply and organ dysfunction occurs. So we have to survive the patient and improve circulation and we have to improve the heart functioning. How to bring back the patient victim to life saving? What we have to do? BLS. What are the steps of BLS? Any idea? Do you have any idea about how to perform BLS? When we talk about BLS, we have to first see patient safety. We have to bring back the patient from any incident or any unknown location. Bring the patient to seat, that is seat safety. Second thing is we have to place the patient in flat firm surface. That is flat firm surface. Once the patient is placed, just check whether the patient is okay. Just by tapping on the shoulder, are you okay? Are you okay? If the patient is not responding, check for pulse. That is carotid pulse. How to check carotid pulse? Just you can see the trachea. Just side to the trachea groove. You can able to groove it and you can able to feel the pulse. This pulse is called as carotid pulse. Just you have to feel the pulse for maximum of 5 to 10 seconds. You should not take more than this. If you feel pulse, then the patient is responding. If the patient is not having pulse, check for breaths. Next thing is, if patient is no gasping, no response, we have to start CPR immediately. How to start CPR? Just place your one hand on center of the chest, interlock it, then your shoulder should be straight. All your shoulder pressure should fall on your hand. When you provide CPR, you should not flex the elbow. This is how to place the position for CPR. And how much compressions to be given is 100 compressions to 120 compressions per minute to be delivered to the patient. In between this 100 to 120 compressions per minute, 30:2 ratio to be maintained. What is this 30:2? 30 compressions, 2 breaths. 30 compressions and 2 breaths. How to count the compressions? When you count compressions, just 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and why we are using the term 1 and 2 and 1, you are going to compress and you are going to recoil it. Then when you compress, next recoil it. Because when you compress, the blood will be pumped from the heart to all the systemic parts of the body. When you recoil it, all the blood, deoxygenated blood from all the parts of the body, venous return comes back to the heart. If you don't do recoil properly, the blood, circulated blood from all the parts of the body, venous return to the heart will be ineffective. Even if you pump, it cannot able to pump enough blood to all the parts of the body. So compression, recoiling is very important. So when you count 1 and 2 and is for mainly recoiling. Once 30 compressions has been completed, then you have to move for breaths. How to administer the breaths? We have to open the airway. How to open airway? We have 2 techniques. One technique is, do you have any idea about any techniques? What are the 2 techniques we are using to open the airway in case of cardiac arrest victim? Head tilt chin lift maneuver. Next one is jaw thrust maneuver. First we will demonstrate and see how to do head tilt chin lift maneuver to open the airway. First, gently place one hand on the head of the head. Make two fingers of the other dominant hand below the chin. Lift it gently. Then you can able to open the airway. Then how to give breaths to the patient, how to use the ammo bag. There is a technique CN, this is C, this is E. How to hold the ammo bag, this is the technique how to hold it. And we have to secure this and hold the chin, lift it, 2 breaths, 1 breath, 2 breaths. Then you have to continue CPR, 30 breaths. Once 30 breaths is completed, then we have to hold it tight, lift the chin, 2 breaths. This is how head tilt and chin lift maneuver will be done. Next thing is, think if the patient is suspected to have cervical spine injury in the neck. When you do head tilt chin lift maneuver, if there is any spine injury, you are going to damage or worsen the spine injury. So we cannot able to move spine. What we have to do in such instances is, we have to move to next technique, that is jaw thrust maneuver. What is it? Jaw thrust maneuver. How to do jaw thrust maneuver? So jaw thrust maneuver is usually done when patient is suspected to have spine injury or cervical spine injury. If patient is not a cervical spine injury victim, we can able to shift to first technique, that is most common technique is what? Head tilt and chin lift maneuver. How to use jaw thrust maneuver? We have to hold both the chin. Then you should not tilt your head. Just lift the jaw from this side. Once if you lift the jaw, we can able to move you can able to see that your airway will be open. We have to hold it on both the sides. You might be heard about lower jaw, lower mandible. It is connected here. So when you lift it, it will lift above and your airway will open automatically, so that your spine will be secure and you no need to damage your cervical spine anymore. Same thing we can able to use hammer. This is about jaw thrust maneuver. Head tilt chin lift maneuver will be given when patient don't have spine injury. If patient is suspected to have spine injury, we will move on to next technique, that is jaw thrust maneuver. So this is about your BLS procedure. In BLS procedure, main things which we have to remember is 100 to 120 compressions per minute is mandatory. Second thing is 30:2. 30:2 ratio to be maintained. 30 compressions, 2 breaths. 30 compressions and 2 breaths. Apart from this, something is important: single rescuer, double rescuer. What is single rescuer? Single rescuer means there is only one person who are going to do compressions also and breaths also. Think I am the only person who are going to handle the victim. I used to do compressions. Then I will take the ammo bag. Then I will do head tilt chin lift maneuver and I will give breaths to the patient. Here, shifting the roles between compressions and technique will waste your time. But if we have two rescuers, for example, I will be doing compressions. For example, we know that 30:2 compressions to be given. When I say 28, 29, 30, the other rescuer will be holding this in position and he will give the breaths immediately, so that we will not waste the time. Once the 2 breaths is given, I will be ready and I will start with the compressions. So in one rescuer, shifting the roles will waste your time. When we have 2 rescuers, that interchanging time will not be wasted. Because when we talk about cardiac arrest victim, each and every passing minute is important to increase the chance of survival. This is about your BLS technique. BLS or CPR, only it does not increase your survival rate. Usually BLS in conjunction with your defibrillator can able to increase the survival rate of the patient. We cannot use any manual defibrillator here, but almost in many places like unknown places like any bus stand, railway stations, anywhere we can able to see AED, automated defibrillators, that we can able to use, so that CPR in conjunction with defibrillator we can able to increase the survival rate of the patient. This is about your procedure. Can you able to demonstrate method? Demonstrate head tilt and chin lift maneuver and back arm to back technique.
I am here to demonstrate head tilt and chin lift maneuver. For this, we need to give the position to the patient like one hand on the forehead and two fingers on the patient chin, and slightly tilt the head of the patient and lift the chin of the patient. Then, how to hold the upper bed? To hold the upper bed, we have techniques like C and E closing. To hold this, we need to hold the upper bed like this and E. C for securing the upper bed and E for holding the chin of the patient. Slightly tilt, don't tilt gently and give 2 breaths very slowly, like 1 and 2. Then give the CPR every 30 CPR ratio of 30:2. Give 30 CPR and give 2 breaths.